guys, welcome to Voices and Vitals, the podcast where we talk directly with the medical professionals about their stories, work, and specialties. I'm your host, Annie, and today we're introducing someone you won't want to miss. So I'm actually super excited for today's podcast because we're talking with Dr. Christopher, an andrologist. So let's jump in. So can you do a little bit of introduction about yourself?
Okay, thank you for having me first. I'm Dr. Christopher as an andrologist in Eka Hospital, Bumi Serpong Damai, PhD. So I worked for 2 years and very nice to meet you.
Yeah, me too. So, actually, the first thing, what I'm most curious about your specialties is like, I heard you're an andrologist, right?
Yes.
Like, it's very special. Can you do like a little bit of introduction? Like, what is it about?
Okay. First, as an andrologist, they take care of four type of patient. The first one is for the erectile dysfunction. The second one for the male infertility, if they cannot have a child for more than 1 years, so they should go to the male patient should go to andrologist. Okay, the third type of patient is children with a small stature, and the fourth one is for the anti-aging.
Oh, even anti-aging?
Yes, we work for the patient with we call it andropause. You know menopause, right? For the female one, but there's also we call andropause.
Oh,
Yes,
so
for the male
it's
patient.
mostly for males.
Yes, 85% my patient is a male.
Oh, then what makes you to choose these specialties?
Okay, at first I want to be an internist, and then I go to uh, okay, I will tell you from the start. Then
Sure.
I went to Atmajaya Catholic University for my GP, general practitioner, and then I go to internship, go to Kediri town for 1 year in East Java. It's for the government duty. And when I have a chance, I go to Erlangga University to see what kind we call it seminar, we call it in Indonesia seminar, like a workshop.
Oh, yeah.
And then I watched Dr. Auki Hinting. He is one of the best andrologists in Surabaya. And they told about IVF, in vitro fertilization.
Yeah.
It's the newest one technology for a patient which cannot have a child. They go to IVF, through IVF, in vitro fertilization. And I watch him and I want to be like him.
Oh, so that was like 6 years ago?
More, maybe eight years ago.
Oh, so it's really special. Wait, then do you think there's like any misunderstanding about your specialties?
What kind of misunderstanding? Like accent?
Because I think this related to like reproductive system, it's a little bit more sensitive, right?
Yes.
Do you think like general people they have like any misunderstanding about it?
Oh, okay, I see what you mean. In maybe 10 years ago, everyone it's a shame
Yeah.
to go to fertility doctor.
Especially in Asia,
Yeah,
right?
in Asia, because they think it's like a curse. If you cannot have a child, it's something like that. So they are ashamed to go to seek doctor. But right now, I think it's very very often.
Then I think you also do like collaborations with the OG specialists.
Yes, the Opchin one, obstetric and gynecologist, they treat the female patient.
Oh, so you guys are the OG for males.
Yes, that's right.
Other than the doctor and the seminar you just mentioned before, is is there any other inspiration for you to choose this?
Okay. Because one of my two of my family they had an infertility and they are uh, uh, very sad. They are very um, what call it? They go to so many doctors. Even they go to Penang, Malaysia, and still didn't work. Maybe 20 years ago, because there is still not a good technology at that times. So I want to help people like them. Yes, it's like my apa ya, panggilan kalau kita Indonesia bilang.
Wait, then have you ever think about to give up this path? Or do you decide like this is something you want to do for the rest of your life?
Yes, I think it's for the rest of my life.
Oh, so you never say like, oh, maybe I should give up. It's a
No.
because I know it's a very tough
Yes,
task, right?
it's a very tough because our patient they are healthy outside, but they are inside them they are very sad and frustrated
Oh,
because they tried so many things like herbal one, maybe acupuncture one, go to many kind of doctors. But in the end, the final therapy is in vitro fertilization for infertility case. It's like yeah, maybe the final weapon for them. But until now, the price is still expensive. If you know, the price is very expensive, so it cannot cover 100% to use IVF in Indonesia. It's the problem, still a problem, still nowadays. Even though the price already maybe 40 and 50% lower than 10 years ago.
did the Indonesian government like support it or?
Not yet, unfortunately. They think infertility is not a disease, and they think they should focus on other disease. But in WHO right now they said it's a disease because I can tell you the fact since 1970 until now 2020 the sperm count has decreased 50%.
Oh, for like almost everyone.
Everyone in the world.
50%.
50%. It's fakta yang mengerikan sebenarnya. Fakta it's very sad but true. Around 1970, the sperm count in American people, it's 50 million per cc. But right now, they make a research. They have a mean 20 until 25 million. So it decreased 50%.
Oh, that's a lot.
It's a lot, very. It's a dangerous for our population.
Yeah, I think so. Wait, then can you share like, is there any patient story that's like really memorable and you think it's like very meaningful for your path?
Yes, it's my first patient in Jakarta. He is from Bali. He cannot have a child for maybe around 10 years. He already go to so much doctor, and then he come to me. So I checked the sperm count. He had 0 sperm count. So I talked to him. We need to have a we call it testicular sperm aspiration. We took the sperm from the testicular because he had difficulty to make the sperm going outside. So they just ejaculate but no sperm in there. And then we took them, and of course we do it with obstetric doctor option 2. The first trial not success, but fortunately they had freezing their embryo.
Oh.
They have 5 embryo. The first one we transfer 2 embryo, not success, and the second one we transfer 2, and one of them is success.
Oh.
For 10 years they wait.
And how old is he?
The male patient 39 and the female one I think 32.
Is that too late for now?
I think it's maybe not so old for a male, because in the research male patient can make a good sperm until he is 45, but for the female they told us maybe 35 is their good one, their last age for have a good oocyte.
To consider, like, I think in the recent years a lot of like environmental factors change, right? Do you think more patients come to you are like young patients than old patients?
Okay, in the first one, for the infertility, they are go to the young one right now, the trend 30, 25, 28. But for the erectile dysfunction, some of them very often more than 35 years.
Then I think is a good thing that more people that are willing to like go to the doctor when they know like they choose to face it, because like I know in Asia a lot of people, especially things related to reproductive system, they will like maybe not, or yeah, as you mentioned, it's like a curse. I think it's about their luck. It's
Yes,
not like
that's
it's
right.
about my health, right?
The tradition in Asia still like that, and they often blame the female one.
Yeah, I heard a lot of stories. like that.
85% my patient still didn't believe
Mm.
that right now it's a 50-50.
Oh.
50% from male and 50% from the female.
Then I think you might face a lot of patients they think it's like an embarrassment to go to you.
Yes,
Like, how do you usually help them to feel like more comfortable?
yes, that's a good question. Because 95% of my patient at the first time they come to me, they come to us, first one they are scared. Why they are scared? Because actually they know, they read everything about it first, right? Right now patient can go to Google, something like that.
ChatGPT.
ChatGPT. They think, oh, very danger story. And when they see us as an andrologist, the first one, we must make them comfortable. We should make them feel like family.
Oh.
So, if you don't make them comfortable, they don't want to talk about it. They silence his mouth.
Wait, but do you have any strategies to like gain their trust? And
Okay. The first one we must, as an andrologist, we must have an empathy.
I think that's for all the doctors.
Yeah,
Right?
but if the andrologist, you must have more empathy, because you know the male characteristic, they have a much more higher ego. Extremely in Asia. So if they know his sperm has a problem, they not just sad. They feel very low. They feel like they are not masculine. It's your job to tell them it's a normal thing. Because that's you need help. You need help right now, and we can help you. That's it. So first one, we have to make them comfort with us, make them tell us their story, and we can check their hormone, their sperm, and their testicle.
Okay, so and also I'm curious about like as an andrologist, how's your like typical day look like? So currently I remember you work 2 days in Eka Hospital and another 2 days in another branch, right?
Yes, and grand family.
Oh, grand family. Is that in PIC?
Yes, in big.
Oh, so how does your day look like? What do you do?
Okay. Fortunately, in Andrologist there are no cytosurgery, so we just work in the day one, morning until night, not in the more than 9 p.m. No surgery, cyto, you know cyto?
So you have no night shifts, right?
No night shift. It's fortunate one. But the unfortunate one, we must deal with a failure patient. They, if you know, if the success rate of the IVF right now, for the most advanced technology is still between 50 and 60%. So 40% fail. That's a difficult one to tell them why they are failed, to make them happy again and want to start another cycle. That's the challenge. To make them believe there is still a hope. Yeah, that's the most difficult challenge.
To continue with the topic about like the Indonesia's government, like how they support the healthcare system in Indonesia, like do you think how can they improve the system?
It's a difficult question because yeah, you know lah, in Indonesia still so many politics, right? Maybe they focus on the corruption first, maybe, and then go to education first, and next maybe go to healthcare system. They must have a prioritize. Right now, I think the first priority is corruption, and then education, and then next to the healthcare.
Oh, so you think in the recent years is a little bit hard to
Yeah, it's don't hope too high.
Yeah, because what I see in Indonesia, like, do they have like a mandatory healthcare insurance that everyone needs to?
They have BPJS, but BPJS just take care of the nearly dead patient, you know.
Like the urgent.
The urgent patient. If they think it's not the urgency one, they cannot use it.
Oh, so usually they cannot use it for andrology?
Not yet, for now.
And also I heard, I'm not sure, but this is what I heard from my friends. They say in Indonesia, if you use a government healthcare insurance, it's like taking a really long time to get approved, right?
I think it's tergantung itu. It depends on the hospital. If it's a good one, they treat the patient first and the payment later. It's the professional one. But if the hospital think about the money, they ask first, what's your insurance? You want to use BPJS or
Self-pay.
private? If the private one, they took everything seriously like that. It depends on the hospital, not 100% hospital Indonesia like that.
Oh. Then, like, do you have any advice for people who want to be an andrologist in the future?
Okay. And the first one, you must have a good empathy. The second one, you must have a good eyes, because you work so much in the microscope. You watch the sperm like that, and then the third one, you should have a good mentality. You must have good vibes, because your patient come to you, they are already depressed. 95% they cannot have an erection. It's a very big problem for the male, right? Because it's like one of the most important thing for the male. If they come to you and you are sad, oh, he will not have a good interaction with you.
Then for how about gender? Because I heard like for the medical field they have like, oh, this gender and this specialist is for this gender and that specialist is for that gender. Do you think for andrologists is it like, do you only recommend it to like for boys to do it?
Maybe 10 years ago, 85% is a male doctor, but right now it's a 50-50 because in my opinion, some of my friends they realize that female doctor can use examination for the male too. So don't worry about it. If you want to be an andrologist.
Wait, so for being an andrologist, if you like compare the benefits and the disadvantages, for the benefits is like you don't need to do night shifts, right?
Yes.
But do you think there's any downsides about being an andrologist?
For right now, I think no downside.
So you're like really happy with your career.
Yes.
Okay, so thank you so much for Dr. Christopher for like joining my podcast and like share so much insights and like patient story with us. So I think that's all for today and stay tuned. Bye.